super nauseous even with everything in my system. Oh. And I brushed my teeth with my toothbrush, which is amazing because we forgot it last time. Okay, so it's the night before the surgery and all I can think is I'm just not ready, but I'm totally ready to get the poop part over. So the next time you'll see me at the hospital. Bye. Sunny's super nice. Okay, we are at the new hospital and I've already registered, and then we came up to main pre-op. They said that they had just gone through like their first batch of patients and so the rooms weren't ready yet. So we came over here and it's labor and delivery waiting room and there's nobody else here. That's super nice. And then Mom's gonna get coffee. And we are back in a room. It is a lovely room. It has my own bathroom, which is super awesome. I got my wingman in the corner. I'm all ready. My sexy socks. Those are horrible. I always feel horrible. Okay, still waiting for all the things. And I'm all checked in. I got, hold on here. I got my IV. Oops, we got a problem. I had a feeling we had a problem. That's not good. Now I gotta call for help. Okay, now I'm all fixed. It's pretty again. I'm about ready to go, so I'll see you guys on the flip side. Bye. And I want to puke and I want to go home. So that's it. Okay, bye. Okay, I made it through coaching. Really bad when I woke up. I don't know how long it took them to get everything under control, but it's pretty under control at the moment. They knocked me out, which was nice. My back hurts. My abdomen hurts. Left side's the worst. I can't feel my port at all. It literally feels like it didn't do it, which is pretty nice. Had some spongy ice water from Mommy. So I'll have, here's my spongy water. It's so funny. We're in a private room, which is nice. We didn't know if it was going to be like that. I'm getting IV fluids at like the slowest rate possible, I think, which is kind of funny. Throat hurts. I still think I'm going to have to take that off on my statin and actually swallow it. Maybe if I gargle, I won't have to swallow it because it's so nasty. Now we have a person. Hello. Okay. We had what I thought was a nurse coming in, but we had a lovely dinner right here. Jello, because everybody has room for the Jello. And tea and apple juice and something else I don't remember.
Lemon ice.
What was the little Italian ice thing? The longer I go, the more I feel my side, where the actual tube is, burning. It's funny having something else hurt worse than my G stoma. It'd take a little time to get used to.
have my pain under control when I left the OR, which I guess is normal maybe. Well, horrible normal for me for the awful part. But I don't know if they can really give anything until I wake up and see how I'm doing. So I'm on my third, I think, Dilaudid, and it definitely takes the edge off, which is nice, but I'm still hurting. I can feel my 3 holes poked in my right side. Not horrible. And one thing that I swear we had talked about before, like my surgeon was suturing down to something magical that's up in there, the port, so that it doesn't flip or rotate. So he said that he sutured it down with 3 sutures, and that should all be on. I'm assuming it's on the inside, but I don't know if that's correct or not. I can't feel the port very much at the moment. They like numbed up all sorts of stuff. It was awesome. My shoulder's a little bit sore. I don't figure I'll know what's really going on until the numb wears off. And my abdomen was numbed. That's supposed to last, what, 3 days more? So I'm assuming they did up top too. And I had my phone, and I was just gonna, ho-hum, set it up here, and I was like, oh, I don't know. So anyways, hanging in there. We've got double meds possible. So we'll figure out what a good combo platter is, and then go from there. My throat hurts, super dehydrated still, like my lips keep getting stuck to my teeth. It's so awkward. So, thumbs up so far. So it's 10:07. Feels like midnight or 2 in the morning. Too long for pain meds, and now I'm chasing it, which is never a good call. Everything hurt. The bottom left side still hurts really bad. Don't know what that one's all about. Everything looks bloody and awful. I'll show you guys tomorrow. Hope you can see this part. I don't have my Mwah. So there's my incision for the port, and the port sits right below it. I'll show you guys tomorrow. So I anticipated all of this to hurt, which it does, but it hurts clear through. So my shoulder blade hurts really bad too. So we've had awesome nurses. Every single one of them has been really great. And then they're going to bring me a couple more things, and then we're going to crash. And I hope to sleep. I just got pain meds, so it's already kicked in. Super nauseous, even with everything in my system. Oh, and I brushed my teeth with my toothbrush, which is amazing because we forgot it last time. So all good, and I'll update you guys more tomorrow. Bye. Okay, so it's the day after surgery. Pain meds were not really effective, so I was chasing pain from about 9 last night. Pretty awful this morning. We've doubled the dose of pain meds, changed another one that I haven't had yet. So if
you don't like bloody or anything, look away. So here's my port. It's all loaded with lidocaine to numb the whole thing, so it doesn't feel too bad at the moment. So that one's that. I'll show you my abdomen later. So I'm in the bathroom trying to clean up stuff. So I'm breaking out into a rash. So I've got one started here. I've got, oh, and it's spreading. And then I've got a rash in that armpit. I've got this started back here. So we're gonna hook up all the things and see if we can get some help. We are so totally getting to go home, and I'm super excited because the hospital's great, except when it's not. So I thought I would show you guys all the things. Okay, so you saw the port. There's the port. I'm mostly stuck together. I have trouble with sutures, and so we're trying Dermabond on it. So it's right here. It's still all swollen. He put lidocaine and stuff in it, so it's not too bad. It hurts all the way back to like the back of my shoulder, but compared to my abdomen, it's pretty not bad. Okay, so abdomen wise, let's talk about all the things. Okay, so this was my old GJ, so it is now just a G, and which is super awesome, and Mickey button. Okay, so this is my new one, super tender. Like y'all remember, I had 3 clips on this one, so I had to have a bonus round on that one. Less ideal, not real excited about healing. And then I've got holes all over here for the laparoscopic part. I was only supposed to have 3, but I got a bonus hole for something. And then if you see all the dots, I don't know if they're over there, and it hurts. Yeah, there's some over there too. So they numbed up my whole abdomen, and it's supposed to last for like 72 hours. So mine lasted for, oh my gosh, it was like 16 hours or something. That was all. So it's all back to life. So it's really hurt. Everything hurts, sitting, standing, moving, coughing, sneezing, any of that stuff. But I get to go home. I think we finally got most of the pain under control with meds. Obviously I have big meds here in the hospital, but we switched from other narcotics that just don't work for me at all to just ibuprofen, and that seems to work a little bit better for me. So it's about 3:35 now, and we're going to start loading up. I have one more dose of big meds at 4, and then my chauffeur will be lollygagging me back to the hotel, not the hotel, to the house. So everybody's been really great. It was way better than the first tube surgery. Still came to screaming, but at least we had enough information to them this time that they could just give me enough medication and knock me out so I could stop scaring the other people in recovery. It's so awful. So, but Mom was there, and she was holding my hand, and she was patting me and telling me that it was all okay. And then I had somebody else on the other side of my face telling me to open my eyes, but I didn't want to. But all better now, so the nurses have all been great. Like, normally you run into at least one bad one, you know? But they've been really, really awesome. And all the surgeons came in this morning just to kind of make sure everything was all right. So we saw 5. I only had 1 surgeon, but I saw 5 surgeons today. So, special snowflake, everybody wants to see all the stuff, but everybody was super awesome. And we had Pastor Kurt come in from Pastoral Services for the church, because it's a religious-based church, it's Methodist. And it was just really nice. I love it when people just kind of show up just to, you know, give you a little prayer and give you a little, we're thinking about you, which has been super nice. And I know all of you guys have been sending really great messages, and I've read them all, even if all I can do is like them at the moment. But I get to go home,
and sleep in my own bed. It's gonna be amazing. So that's it for this round. Okay, so this is my cool breathing routine so I don't get the pneumonias routine. And so you have to suck on this right here, and you have to try to keep this in the little arrow thing. And then that was my sissy little goal, even though a normal person can do it up here. But I got the sissy goal. And so you have to try to keep this part between the lines while you're doing the other part. So I'm at my goal, so now we get to go home.
Okay, this is Thursday, so 3 days post-op. These are getting better. They're not as tender as they were before. This one's still tender. This one's really, really tender. And then I actually have an extra bonus incision down there. That one's not too bad either. My G-tube is sore. Not horrible though. And I just had some stuff to eat. I ate applesauce, a little bit of cream of chicken kind of soup, and I had a little ice cream. This one's not too bad. That one's not too bad. That one's more bruised though, which is interesting. Can you get closer on that one for me? So the new tube, like you can see it like from the top, like you see how this one like totally fits the space, like I don't have extra stock. This one I have extra stock. It's obviously the worst trauma. I've been cleaning it a couple days with Q-tips, like it's getting better, but it's not great. It seems less sore than this one was when we put it in because I'm not having all the secondary complications. It feels the same when I get up and down, but not when I'm just standing or just sitting or laying, whatever, which is super nice. Okay. Now, so port incision, I mean, you can see all the bruising, like the bruising's down to here. It sure doesn't feel good at the moment. Some of the swelling has gone down, so I can tell like where my port is now. It is a dual lumen, and it feels almost like a weird shape. It's not exactly what I expected, but it's also more in my armpit than I thought it was going to be, which I don't think will be a problem. I've had a couple people have their port kind of in this area as opposed to more like on your chest, but they were trying to use the smallest good vein as possible because if anything happens to this one and I have to have it changed, it has to be changed to another vein. Okay, so bruising, it sucks. I mean, the whole thing hurts. But I have this amazing rash going on. Can you see it? I don't even know if you can see it on camera. Mm-hmm. So it was not on my arm at all yesterday. So it was in the back. Can you still see it in the back? Mm-hmm. So that's all it was just kind of like in the crook of my armpit. And I stopped taking Benadryl because it's hard on my body to process and whatnot. But it just keeps getting more irritated and more irritated. And so it's down to about here right now, and it wasn't on my arm at all. So we went back to taking 2 Benadryl every time I can. I'm back on the Zyrtec. I'm back on the Flonase, the nice kind. I don't think I took my Zantac last night, so I'm going to try to get back on a full med regimen now and see if that'll help. If it's worse tomorrow, there's nothing I can do but either go to my doctor or go to urgent care, and I'll have to have steroid shots to get rid of it. So it's on the verge now, which is frustrating. Breathing hurts. Sitting, standing, laying hurts. I'm glad I'm past the real poopy part. So I feel less out of it today. Like a whole lot of Tuesday and Wednesday kind of blurred. I think I lost most of Tuesday. It's Thursday, right? Okay, so it's Thursday, right? I lost most of Tuesday and Wednesday. I just don't remember a whole lot of stuff. I remember certain things, but I don't know what day they were on. So for this we're doing Benadryl, 2 Benadryls every 6-8 hours. And then I've got Benadryl, like clear anti-itchy stuff. So we're keeping that pretty coated. It's so irritated. Like I just want to itch it like mad. And it has that MCAD feeling to it that literally I know if I touch it, it's just gonna spread like wildfire down my side and down my arm. There's no way I can handle that at the moment, so I'm trying so hard not to touch it. I was worried about how I was gonna sleep here. Not so much the up and down, whatever, but the actual sleeping part. Because I don't sleep on my back, that's not my thing. But obviously I don't have any choice at this point because everything is pulling on the inside. So I got into my bed. Mom got one of my big pillows like under my knees. So my lower legs were lifted up a little bit. It took a lot of the pressure off my abdomen, which was amazing. I just kind of laid there. So I was down from about 3 in the afternoon yesterday, Wednesday. I didn't get up. I didn't get out of bed at all until like 5:30. So my mom was rushing in to make sure I wasn't croaked or in a hypocoma because I don't.
That was a.m.
Right, 5:30 a.m. And my other sensors and transmitter and stuff were coming, but I was kind of glad that I didn't have it because I only had like pudding yesterday. I don't remember what else I had. Very, very limited food. I just didn't want to have to deal with it on top of all the hurting and the whatever. So I did a little bit better today, but progress, I guess. I'll keep you posted. Okay, so today is Saturday, so 5 days post-op. Super exhausted, everything hurts. My insides just hurt all over. Inside, outside. Still feels all swollen and I think you can see that part. All the incision marks hurt. They're starting to itch. This one itches, this one itches. This one's more sore than anything still. So this tube's doing awesome. It really hasn't hurt since I got it changed out. I mean, it hurt the first day just because of all the monkeying, but not the rest of it. We started using my cool gauze pads that they sent that I thought were horrible and aren't horrible. We've gotten everything pretty much clean around that one, which makes me feel better because they were so tight together, like the clips were so tight together. So it's a little bit more accessible. Last night I was laying in bed, last night, and like everything was making these gurgling noises because I hadn't started going back to the bathroom again, and so I thought it was that, but it was like this wave of like stomach cramps, and you would hear it, and it was like my J was venting, which I've obviously never had to deal with before. And I never had to deal with that with my G either when it was healing the first time, that like gas would escape from there. But I was having gas escape from my J like around the stoma, not through it because it wasn't open. And so like the kind of like yellow bile from a small intestine. Like that's what was coming out of it. It was a little unsettling just because I'd never had it before. Seems okay at the moment. It's still super swollen, like it's almost all at the bottom. Having anything in my system just makes me feel more bloated. It's just like it's straining against all of the owies, which is less ideal. And then I can feel pretty much everything again. It's super sore. I mean, it's sore how it looks. So it goes, my bruise is still extending down my arm. So that part hurts too. It's just really, really tender. And like I can feel the barriers of my port now. And one is like right in my stinking elbow. I mean armpit. And then it comes over to about right here. Not very sore. I can move my arm a lot better today, which is nice. Finally started going to the bathroom again today. And it started with a bang, which is totally awful, but I just don't have to worry about that because I didn't know if everything was really working yet again. So I'm exhausted. All I want to do is sleep. So I'm gonna go do that. Bye. Okay, so it's been a week and 5 days since the surgery. I've decided I don't want to hurt anymore and I'm done with it. So apparently that's not enough of what it is. So okay, so one last update before I get all finished and do this video and then we'll switch off. Okay, so I still don't know what this is. I need to add it to my list of questions because I see my surgeon on Tuesday. So I've got streaks of it here and then like a circle of it here. And it looks almost like burned, but it's not, like it doesn't hurt or anything. The bruising finally stopped spreading down my arm. It still hurts, super sore. I've got most of the dermabond off. There's still a little bit up here. So I've got one suture that was still exposed, so of course that's infected. But I'll keep stuff on it until I can get him to cut it out Tuesday. The pocket that the port sits in doesn't hurt. This I was worried about because it was so bruised, but that doesn't hurt anymore either. So that's nice. Obviously, I haven't had to access any of it yet since I won't technically have to access it for another 2 weeks or so, but we'll be getting all of that lined out on Wednesday. Okay. So, get all tucked in here. Okay, old tube, new tube. I have all the dermabond off, pretty much everything on my abdomen at the moment. So this one bruised more out of all the big incisions. It doesn't hurt too bad. This one doesn't, it never really bothered me all that much. This one and this one, I reacted to the dermabond. So they were super itchy and irritated and hurt. So I got all those out, but like there's huge knots under my skin. I had another laparoscopic procedure. I just don't remember huge knots under there, but I don't know if there's lots of sutures and I'm just reacting to the sutures or what it is. So we'll ask about that on Tuesday as well. All of my shot locations of where I had the nerve block put in, they're all doing pretty okay. These aren't bad. I don't think they were ever bad. This one bruised the most. So it goes up to about right there and it goes down to about right there. So this one is really sore. you can see, I don't even know if you can see it in the camera, but like you can see all the way around my whole tube. New one is just swollen. It hurts all the time. It doesn't ever stop hurting right now. I know I had swelling around the first one too when we did that. Obviously this one is super good. No stoma issues anymore since I got all the other tubes and stuff out of it, thank the Lord. Okay, so can you get it from the top? Like, this tube doesn't fit right. See how much extra space I've got? Like, none of that space is supposed to be there. I know this one was just kind of we had to go with something, so I think they're actually both the same size tubes. So they're 18 French 3.5s. But I have more muscles up here, and so this one fits flush, this one doesn't at all. Okay, so something I figured out last night. This clip is okay. I can touch that one. This clip is okay. I can touch that one. The clip on the bottom is not amazing, but I can touch it. The one on the top is literally hell on earth. I can't even get this close to it without it. It feels like it's ripping apart. Like, it feels like it's ripping apart about an area that big, like where all the swelling is. I was trying to figure out, because I had all this like oozing and blah 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 that I didn't really have on the first one. So this one, I guess it kind of took me by surprise that it's so different than the first one. Don't know why. They're always different. There's no rhyme or reason. So because I keep looking at like the redness around the tube, and it's not touching either of these, but it's touching the top one and the bottom one, which really hurt. And so the only way I can clean it right now is just to get in the shower and just like let warm water go over it. I was trying to do it with Q-tips, like to actually get off the crust and stuff, and it's just awful. I mean, it's just, I can't even tell you how bad it hurts. And like those two clips, like when I touch anywhere else, that's what hurts. Like it's like this straight line between the two. But I also don't know if any of those sutures wrap around the tube that's on the inside. I'm not actually certain. So I'm super ready for the clips to be out, but I know my clips didn't come out for 4 weeks on the first round. And obviously I want everything to heal, and I don't heal like a normal person, and so I'm a little concerned that I'm gonna have to deal with this for like 2.5 more weeks, which really doesn't sound like a good time to me. But obviously, I mean, if it's doing what it's supposed to, then okay, but so anyways, we'll talk about that on Tuesday. So now I'm gonna get all wrapped up and pain patched and all that good stuff. So I'm finally gonna end the video. So I have the second tube. Yes, it really sucks. I have the port. That one does not suck. So we'll see how good it is. So give us a like and a subscribe below, and I'll see you guys later. Bye.